Healthcare development is a very unique asset class. When you look at commercial real estate in general, we really rely on who a tenant is in a building and can they pay the rent. That's been the overall fundamentals of commercial real estate for years. Healthcare adds a nuance to that. And it is not only driven by who your tenant is, whether that's a hospital, a physician, a venture-backed healthcare startup group, and can they pay the rent, but what is the operations that is happening in your building? And in the course of the last decade, when you're developing healthcare real estate or investing in owning healthcare real estate, it has become more and more important to understand the business model of your tenant. And healthcare is getting more complex. It's where some of our largest GDP spend is in healthcare and the nuances within that. So how does that translate into healthcare real estate, healthcare clinic development? One, let's start with traditional healthcare. When you think of hospital systems are really getting away from that setting of the acute care hospital. And it's becoming more cost effective for those health systems to develop clinics and see patients closer to their home, where they're going to see patients more often and get in larger revenue streams. There's also a huge push for hospitals to do a hospital at home model, meaning patients are not going to be coming to those hospital campuses as much as they used to. It's not being reimbursed the same way through government dollars. And so there is a huge transition happening right now that is, one, patients being seen virtually, and two, closer to their home in lower cost settings. So virtually, that brings up our second topic of technology, AI. How is that playing into healthcare real estate? And that's a big component of it. There are a lot of services that we are able to do virtually now and through different technologies, such as remote patient monitoring technology. And that really comes into play with the older senior population that we serve. That is all creating a need for two things: smaller physical real estate plants, but also spaces that are much more flexible within that clinic. The third thing it's doing is creating opportunities for what was traditionally healthcare delivery space to be a community environment for patients, to come in for non-traditional healthcare services, such as education classes, social events, fitness classes. These are all spaces that haven't traditionally been in a healthcare setting, that we're really thinking of these more as community centers than true healthcare delivery buildings. The last piece that's happening in healthcare is the continuance of our move from a fee-for-service system to a value-based care system, in how healthcare groups are getting reimbursed and paid for the clinical services that they deliver. And as we move through that system, a lot of innovation is happening. And when innovation happens, we're getting a lot of venture capital and private equity dollars that are very interested in the healthcare space right now. So there are a lot of new entrants in the space that are not traditional healthcare providers or hospital systems that will be looking for more physical plant real estate needs to deliver their services. When we look at healthcare, there are certain aspects of healthcare that are becoming more regulated in areas and also being governed by different state programs. So in the senior housing world, we have a CON, or certificate of need. There are also CONs for different healthcare facilities that you need. And within that, there are also different state programs for seniors that require state and license approval. All of that does the same as a CON. It adds more time. It adds more time to the development process, not as much on the real estate, but for the operations to get the licenses that they need to operate their business. So it's adding timeline, and time always adds more cost, carrying cost. And so when you're looking at the cost of development over the last 5 years, we've had inflation that's hit materials and labor. For the most part, the materials have leveled out. The labor is still going to increase. We do not have enough construction labor, both from the actual laborers and the leadership for superintendents, project managers, etc. in this country. We do not have enough that are coming into that space to sustain the demand. And so pricing, salaries for that personnel are increasing cost pressures. And then the last, the regulatory environment that I just mentioned. That's adding more time to projects. Time equals more money. We're seeing increases in cost. But how can we combat that? There's lots of things that you can do to work with municipalities to try to expedite some of the approval process for your building permits. There's things that you can do with the project schedule. It's why it's so important to work with an experienced general contractor and developer in the healthcare space who understands how to stage projects appropriately, give our operating business partners, clients enough time ahead of completing a project to know when they should submit to the state, to the federal government for their specific licenses, and that can time that out so when the building is done, we're as close to ready for operations with those licenses and approvals as we can be. It's no secret that behind successful real estate has always been location, location, location. And I would say now it's even more granular than that. It's block, block, block. What literal block on the street, census tract? We're not talking about zip codes anymore. We're not talking about general cities or towns. We're getting very specific of specific streets, specific intersections to be able to target the right demographics for our real estate projects. What is helping with that? Absolutely AI. We are able to really pinpoint and take data from lots of different sources to come up with very specific targeted areas by product type of where we should build and develop. This is across senior housing, this is across healthcare, and across our entire platform of what Avenue develops and builds. We are getting very specific on not just location, but by what streets we need. Partnerships are as important today as they were when Avenue was founded. It is the true pillar and essence of who we are as a company, both from development and construction. Partnerships are important not only for the success of the real estate and that investment, but really for the people who are using the services in our buildings, whether they're healthcare clients or they're our residents in senior housing or active adult. It is really evident when clients walk into a building, residents walk into a building, and they can sense like the culture behind the operations there. That it's not just a building, it's not bricks and mortar, it's not something that people invest in or a bank invest in and they want to return on that. They can feel that sense of partnership and how important it is to everyone in that building that we're working together. And that really speaks to the heart. That really speaks to the heart and mission of Avenue, is creating working alignment across our continuum with all of our partners. Healthcare has always been a market segment that has attracted a lot of investment because returns can be compelling. What most people miss in healthcare investment, though, is going back to that piece of, do you understand the operations in the building? Do you understand what is happening and how long you should hold on to that investment? Do your investors, do your lenders know and have a full picture of the operational model? Because that will make or break the financial success of your building. If you don't understand what your client is doing in that building day to day, you may think that they'll have a fully operational business model in a year. And your plan, and you've told your investors, your lender, is that you're going to sell it within 24 months. If you don't understand operations, your client, that tenant, may not have a stabilized operating business by then. And so understanding the nuances of healthcare and what is happening in that building are incredibly vital to underwriting a successful financial pro forma for your investment and lending partners in healthcare.